am starting the recording now. My name is Mark Canavera. I am one of the directors of the Care and Protection of Children, or CPC Learning Network at Columbia University, and we are really delighted to have several hundred people interested in this webinar today, Understanding and Ending Violence Against Children, a Holistic Approach. This webinar will feature a new conceptual framework that Dr. Mike Wessels and Dr. Kathleen Kostelny have proposed for a more holistic understanding of ending violence against children in line with the principles of peace psychology. We will start the webinar with a presentation of that new article, which you can find in the handout section. And then we will have a short Q&A before turning to three respondents, Dr. Amy Ritterbush, Andy Dawes, and Stella Ayo Odongo. I will present each of these in turn, but before we get to that, just a few housekeeping pieces. You can at any moment send a question to the presenters in the questions section of the handout, and there is also a chat function there. We are more likely to catch the questions in the question section, so please do use that. You'll also see in the handouts section of the sidebar 4 attachments that you can already download, and we will share these with you afterwards as well. These include the article that Dr. Wessels and Dr. Kostelny will be presenting, a response that Andy Dawes, who will also be responding today, prepared, a response that I myself, Mark, prepared, and then the PowerPoint presentation that we are going to see from at the beginning of the presentation. So with no further ado, I am going to hand over to Dr. Mike Wessels and Dr. Kathleen Kostelny. I'm going to be putting their biographies in the chat as soon as I've introduced them. But we are very lucky to have two luminaries in the field of children's rights and child protection here with us today. Dr. Wessels is my colleague at Columbia, where he is a professor in the program on forced migration and health. And as you'll see in his biography, has developed often together with Dr. Kostelny, a very important line of inquiry and research in the past several decades, but really looking at how we can flip the script and not impose top-down approaches to child protection, but really listen to children, families, and communities to build child protection systems from the bottom up. So for those who don't know Mike, and I'm sure there aren't many on the call today, but for those who don't, really digging into his and to Kathleen's literature, it will be very rewarding. I will also put the link for Dr. Kathleen Kostelny, who has been a partner in crime with Mike on this work and is also a senior scientist at the Child Resilience Alliance. So with no further ado, I will hand the microphone over to Mike and Kathleen, who should be able to share their screen now and put the links for their biographies in the chat box. Do you have control of the sharing, Mike?
Yes, Mark, and I hope you can hear me okay and see my screen now.
Yes.
Wonderful. I'm trying to get the function on fully. Great. So it's a great honor and a privilege to be with everyone today. I think we're all here out of our common concern about the enormous proportions and diversity of violence against children. And I think all of us have been striving over the years to strengthen our work to reduce and prevent this violence. And today, Kathleen and I want to present a suggestion for sort of the next step in the work on violence against children. In many ways, it's really not terribly new. I mean, it draws on thinking about structural violence and structural considerations that have been very prominent in movements such as liberation theology, Black Lives Matter, Me Too, certainly social determinants of health, but it has not really been integrated into child protection. And we want to make a humble suggestion that it would be very valuable, even essential, to look at violence against children more holistically, using not only the lenses of children's social ecologies, but also thinking about the relations between episodic, structural, and cultural violence at all levels. So what we're going to do is discuss briefly some current efforts to end violence against children globally. We'll discuss its scale and impact. We'll talk about structural violence and cultural violence. And then we want to turn to the Global Partnership to End Violence Against Children, which has made enormous contributions. And then building on the learning from many stakeholders, including some of the really strong researchers and practitioners who are participating in the webinar today, we want to step back and think critically on our current efforts and suggest the need to do more work to address structural violence as a complement to the existing work on violence against children. And all of this is in the spirit of inviting dialogue and problem solving on how to develop more holistic efforts. So with that, I'm going to turn over to Kathleen Castelny, who will give an overview of episodic and direct violence against children.
Thank you, Mike. So I'm just very briefly going to be talking about episodic or direct violence against children, outlining the scale, the diverse forms, and the impact on children, just by way of review. And I think, as most of you already know, violence against children is an enormous, pervasive problem. It occurs in zones of armed conflict, as well as inner city war zones, in places where children are supposed to be safe, in their homes, in their schools, as well as in many other contexts. A global analysis found that half of children worldwide, 1 billion approximately, had experienced violence in the preceding year. Violence against children begins early in their lives. 75% of children between the ages of 2 and 4 years regularly experience violent discipline by their caregivers, and 1 in 4 children under age 5 live with a mother who is a survivor of intimate partner violence. Violence is perpetrated by people close to the children mostly. Household members are the most frequent perpetrators, and also the main perpetrators of sexual violence against girls are intimate partners. So I think it's useful to look at the main definitions that are being used today. The CRC defines violence as all forms of physical or mental violence, including sexual abuse. While within this broad definition, the WHO defines violence against children as the intentional use of physical force or power, threatened or actual, resulting in actual or potential harm. And I think this definition is useful because it points out the importance of intentionality and the use of power, as well as physical force. And both definitions capture the idea that violence against children may be physical or psychological. So in examining violence against children, it's proven useful to use a social ecological perspective that looks at different forms of violence. For example, distinguishing between physical, sexual, and psychological, and at the different levels, such as at home, at school, in the community, and larger society and internationally. So for example, at the family level, children may be disciplined through beating, they may be sexually abused and threatened. In schools or in community settings, children may be bullied, beaten, or humiliated by peers or by other people. At societal level, children may be demonized, harassed, or even killed because of their religion, their ethnicity, or their sexual orientation. And internationally, violence is evident in child trafficking, child pornography, and the recruitment of children across national boundaries. Gender. At these different levels, violence varies by gender. So while both boys and girls are subjected to sexual abuse, in most countries, girls experience the burden of sexual abuse. In contrast, in many countries where corporal punishment is practiced, boys, particularly adolescent boys, are often subjected to harsher forms of physical punishment than are girls. So some of the risk factors, I won't go over them, but you can see that they're diverse and apply across all levels of children's social ecologies, and that most of the risks are social is a reminder that violence against children is a problem of social relations and of unequal power. Some of the impacts, of course, the serious injuries and death, but it also includes mental health problems, including PTSD and continuous stress disorder, and psychosocial impacts that affect their healthy development and well-being. Experiences with violence can also result in negative coping strategies, including alcohol and drug abuse and engaging in risky sexual behavior that have adverse long-term impacts. Violence can also become normalized and legitimized by children. They can be socialized to use violence as a means of obtaining power, status, and control. There are also intergenerational impacts. They may be at increased risk of perpetrating interpersonal violence. For example, the UN multi-country study on men and violence found that men who experienced violence as children perpetrated intimate partner violence as adults. So this intersection between violence against children and violence against women in the family occurs in diverse contexts. It's grounded in gender norms of subjugation and discrimination against girls and women, and underscores the importance of attending to structural and cultural violence. So with that, I'm going to hand back to Mike.
Thank you, Kathleen. So turning next to structural violence, Johan Galtung, a distinguished peace researcher, talked about structural violence as harm caused by unequal social arrangements and institutions. And he said in 1969, there may not be any person who directly harms another person in the structure. The violence is built into the structure and shows up as unequal power and consequently as unequal life chances. And what we see is that structural violence is a phenomenon of unequal power. It entails social injustice and inequalities that may be embedded in social, economic, political, religious, and cultural institutions. And whether we're thinking about coloniality, racism, sexism, capitalism, all of the isms really have structural violence embedded within them. And structural violence causes preventable deaths and very extensive suffering, as we'll see. So some of the aspects of structural violence are very strong power asymmetries, and one that ought to capture our attention is the power asymmetry between adults and children. I mean, adults wield enormous power over children. Children are often told to be seen but not heard, and this begins a whole litany of problems, as we'll discuss. There are tremendous inequities according to gender, ethnicity, race, religion, sexual orientation, ability, status, social class, and so on. And in essence, there become divisions between haves and have-nots. And extreme poverty and deprivation then become widespread. and affect the lives of millions of people. And it's often backed by discrimination, not only in laws and policies, but also in civic life. Ultimately, it comes to be seen as normal and sort of the natural way of things. But what should not escape our attention is the enormous psychological weight of this. People on the bottom rungs feel stigmatized, humiliated. Oftentimes, they internalize a sense of their own inferiority and their own cultural inferiority. And oftentimes they experience considerable hopelessness. Many of the drivers and root causes of extensive VAC come from structural violence. And as we see during the COVID pandemic, there's a heightened vulnerability amongst the have-nots. And that vulnerability is physical, psychological, spiritual. It is not physical alone. Structural violence against children has profound impacts, and maybe we can start with the physical impact. UNICEF estimates that about 5 million children under 5 years of age die a preventable death each year. And what we find is that when you look across low and middle income countries and high income countries such as Denmark, Germany, US, New Zealand, Norway, and so on, there's a tremendous difference in the under 5 mortality rate. So this chart shows that it's fundamentally higher in places like Chad, Central African Republic, Nigeria, Somalia, than it is in countries such as Norway, the UK, Canada, or the US. We find that in 2015, there were an estimated 736 million people who lived with household earnings less than $1.90 per day, which is often used as a definition of the cutoff for extremely poor people. But what we forget is that nearly half of extremely poor people are children under 14 years of age. And that extreme poverty frequently leads to school dropout, dangerous labor, trafficking, sexual exploitation, a very long list of child protection issues that damage children's development and well-being. And the deprivations of good housing, clean water, access to clean water and quality healthcare and education, all these can have powerful effects on children, particularly during the first 1,000 days of life when neuronal connections are being enriched and when the human brain is developing. Children from the poorest families suffer enormously during COVID. But what we see is that even apart from the pandemic, there are long-term effects of toxic stress on children, which have to do with psychological and social stress, but also with the material conditions of living, growing up without access to basic necessities, living in places where you're drinking contaminated water, breathing contaminated air, and leads lifelong to illnesses such as asthma and diabetes and a whole host of other issues physically, and that complements the psychological problems. A key for us is that there's circular causation between structural and direct violence against children. And here I want to use examples from the US just to drive home the point that no society is exempt from these things, and that it's not a matter of living in a very poor society or a relatively well-off economic society. So this slide deals with the issue of spouse abuse and the structural violences in the form of patriarchy, a system that systematically privileges men over women with associated norms of masculinity and leads many men to demand obedience from their wives. And if the wife disobeys the man or even disagrees with the husband, that can be seen as a transgression that is answerable by spouse abuse, as a presumed punishment to bring the wife, quote, back in line horribly. Children frequently witness the spouse abuse, which is often associated with direct violence against children itself. And the spouse abuse strengthens a system of male entitlement and privilege and increases the psychological harm done to women who live in continuous fear. And it also sets the stage for additional spouse abuse. So this circular interplay strengthens that dynamic. And a similar dynamic often plays out in intimate partner violence amongst teens. So this is something that does affect young people very directly. A second example concerns racism in the US. And this is only one example, but it's obvious that profound discrimination against African Americans is present in the US, and they've long suffered discrimination and social, economic, and political inequities, even after the abolition of widespread chattel slavery in the US. And I think there's been a lot of media attention, appropriately, to the fact that police are more likely to stop, search, arrest, and abuse African American teenagers than white teenagers. And African Americans, of course, are far more likely to be imprisoned than our whites. So young African Americans and many others have participated in Black Lives Matter protests and a number of other protests against racism over the years. And yet these mostly overwhelmingly peaceful protests have often been followed by backlash and violence against African American youth aimed at, quote, keeping African Americans in their place. Another horrible example of the interplay between structural and direct violence, which becomes a self-perpetuating cycle. Galtung defined cultural violence as, quote, those aspects of culture, the symbolic sphere of our existence, exemplified by religion and ideology, language and art, that can be used to justify or legitimate direct or cultural violence. So cultural violence goes hand in hand with structural violence and often seems to legitimate it or make it seem natural. Psychologist Dan Christie and I have suggested that cultural narratives are cultural violence, and they make structural and direct violence seem right, legitimate, or justified. And as an example from the US again, ex-President Trump described immigrants as mostly criminals and rapists. And this, of course, legitimates and gives strength to the cause of those people who want to engage in violence against immigrants. And of course, it also seemed to justify the horrible policies enacted by his administration, which included at the US-Mexico border, harsh detention, mistreatment and separation of children from their families, and other heinous human rights violations. Cultural violence has numerous facets, but I just wanted to mention that, of course, culture is not homogeneous or static, and of course it has political, social, historic, psychological, and economic roots. But in ideology, we see enormous power asymmetry. And in the US, for example, in regard to the mistreatment and structural violence enacted amongst Native Americans, we saw ideology play out in white supremacy and in the doctrine of manifest destiny, which made it seem justified that Native Americans be fought against, subjugated, herded onto reservations, and powerfully mistreated, as occurred, for example, when US troops actually handed out blankets, presumably as gifts, when the blankets were infected with smallpox. In addition, there are social norms, frequently unwritten social rules that may condone forms of violence, such as child beating and early marriage. And so, for example, with regard to child beating and harsh corporal punishment, parents may harbor the empirical expectation that most parents beat their children. So that tends to encourage their own beating. And in addition, they may have the normative expectation that good parents should discipline their children in order to teach them good behavior. And those two oftentimes lead to a fear that if they don't beat their children, they'll be criticized as bad parents. And these social norms can really produce a lot of persistence to change. And then there's a lot of victim blaming. So teenage boys who sexually assault teenage girls often avoid conviction because the victimized girls may be seen as having dressed or behaved inappropriately, even though their human rights have been profoundly violated. Now, the efforts to reduce violence against children have been long-standing, and they're diverse, and they often include action of local, national, and international efforts. Significant milestones include, of course, the UN Convention on the Rights of the Child, its optional protocols, and of course, its sister regional instruments such as the African Charter on the Rights and Welfare of the Child. Another milestone was in 2006, the UN Secretary General's study on violence against children, which sort of pulled back the sheets and showed just how widespread worldwide violence against children is and how what damage it causes. And the formation of the Office of the Special Representative of the Secretary General on Violence Against Children. And then the formation of the Sustainable Development Goals, which has multiple items, but especially target 16.2, which calls for the elimination of all forms of violence and exploitation and abuse against children. But today it is a global partnership to end violence against children, which was launched in 2016, that really leads as a standard bearer and leads the fight to end violence against children. It's a public-private collaboration amongst diverse actors. It has 33 pathfinding countries that have made rather amazing commitments to ending violence against children and then work in a concerted manner to address it. And I'm not going to go through, it would require a separate paper and a separate talk to detail the good work done by the global partnership. But its achievements include getting back on the global agenda, which is a very significant accomplishment. In addition, the national assessments, the population assessments of violence against children have really heightened attention to and awareness of the harm caused to children and galvanized action. It sparked extensive programming to end violence against children, often with very positive outcomes for children. And so today one sees lots of this kind of research and practice going on. And it's an evidence-based approach. The INSPIRE strategies developed by an interagency process and published by WHO outlined some very powerful evidence-based strategies that came from different parts of the world. And then the partnership has been quite effective in mobilizing resources to undertake this historic task of ending violence against children. This is a quick listing of some of the INSPIRE strategies. I think they are familiar to most people, but the fact that they are evidence-based cannot be underestimated in terms of its importance. The field had really struggled without a solid evidence base, and to make this work most impactful and to achieve humanitarian accountability and to convince policy leaders and donors to really invest in it and get behind this effort, it's really key to have strong evidence, both qualitative and quantitative. And INSPIRE has helped to do this. But there are quite a number of challenges, which I won't go through in huge detail. There are problems of definition. Local people sometimes define a child not chronologically, but according to their behavior and whether they do adult work. Even terms like sexual violence can be defined differently. Sometimes it refers only to acts of penetration. Other times it refers to more broadly to things that include harassment. Even our terminology, the thinking about direct violence doesn't really capture children's experience through witnessing. And talk about episodic violence, but is it really discrete episodes or is it more like a continuous stream? With regard to measurement, underreporting is a huge problem, and oftentimes measures are used that have not been validated in the local context. There has also probably been an over-reliance on Western approaches as following colonial tendencies, we maybe have not paid sufficient attention to indigenous ideas and practices for reducing violence against children. Donors often prioritize quick results, working on a scale when there may not be sufficient attention to the fact that it takes time and many years to change some of these practices. And sometimes when we scale up, quality goes down or doesn't get attention. Sustainability is not always uppermost in our mind. And there are a whole variety of do no harm issues. In Sierra Leone, during some qualitative learning, we talked with one mother who said that because she had been taught about child rights and the problems of beating her child, she had stopped disciplining her child by beating, but instead she starved the child. And so obviously that was unintended harm, and this is a constant issue in all of our work. But I wanted to call attention really to the lack of comprehensiveness. The question that this presentation invites us to think about is, can we stop violence against children without attending to the structural violence that is among the sources of root causes and structural drivers of that violence against children, and that enters into circular causation with that direct violence. So to conclude, we're making progress in addressing and reducing violence against children, but current efforts ought to be complemented by more attention to structural violence and its circular interplay with direct violence. If we attend to these things, we would complement existing efforts and reinforce efforts to reduce direct violence. I think we need to think and work together in developing methods, tools, and approaches, working collaboratively to develop a next phase in addressing violence against children that includes measuring and addressing the dynamic nexus of structural violence, direct violence, and experiencing violence in children. So I'm going to end there, Mark, and hand the screen back to you. Thank you very much, and I very much look forward to everyone's comments and inputs. Thank you.
Wonderful. Thank you so much, Mike and Kathleen. And we already have a couple of questions that have come in that I will share with you, and then we will go through those before we go to the respondents. I think both of these are very useful. Janice Ridsdale tells us that she found the framing of episodic, structural, and cultural violence extremely useful when thinking about the layers of discrimination and violence that refugee children are subjected to in many countries. Do you have any specific recommendations on how your paper could be applied in strengthening prevention and response to violence against refugee children, particularly in countries that are not signatories of the 1951 Convention and provide few rights for refugees? So what to do when the structural piece is not strong, the structural protections. And then I apologize if I'm mispronouncing the name. Konjit Kafetu has asked if we can consider harmful practice such as female genital mutilation and child marriage as cultural violence against children. So I think Konjit is trying to apply these categories to violations that they are aware of. They have added a new question that is, what do you think about I'm going to do, since we've already asked one of Konjit's questions, I'm going to ask Claire O'Kane's question, which has just come in. Climate change is increasingly being identified as a form of structural violence, and do you have any comments on climate change? So 3 very pointed questions. Hopefully, Konjit, we will get to your second question in the open discussion at the end. Thank you, and back to Mike and Kathleen.
Okay, well, thank you so much for those questions. This is exactly what we had hoped would happen during this discussion. We're really not at this point in a position to identify the answers to all these things. I mean, I think we need to be humble and to recognize that at this point, we're not doing enough to measure structural violence and its relations with more direct violence against children, and to identify what are the protective factors, how do we reduce the structural risk, but also how do we strengthen the protective factors. So with that in mind, Janet, I could not agree more that this is a profound problem. So many refugees, asylum seekers, IDPs are without protections, and yet they face enormous discrimination. But I think one of the things that the Global Partnership on Violence Against Children has taught us is that if we get together and make a concerted effort and collect some hard evidence of the damage that's done by these things, that we can get it on the agenda. And then we can stimulate the work that needs to be done to identify how do we reduce this discrimination? How do we strengthen the policies, but also their enforcement? How do we work at the civil society level to work with faith leaders, with youth groups, with women's groups, with natural leaders to reduce discrimination at multiple levels? And I think this is really the point of the paper, is that because structural violence is not centermost in our minds, we have very little to actually say at this particular juncture about how exactly to reduce it. I mean, we know that massive movements such as, Greta Thunberg's, and other youth, enormously valuable actions on climate change have profound impact. We know that Black Lives Matter, Me Too, and other social movements, have a big impact. But we don't yet have a very structured way of going about measuring structural violence and then integrating it into our work on limiting all forms of violence against children. And this is exactly what we need to do. So thank you for calling attention to that. And Kundi, thank you for underlining the fact that cultural violence is a powerful term, not just because of representation, symbolic, but also because of the fact that, in the same way that some of the worst violence against children comes from the family, some really horrible violence against children comes from culture. But I think it's really important not to demonize family and also not to demonize culture. Cultures are dynamic, they're not static, they're always undergoing change. And we're finding that, for example, in the UNICEF studies on how to try to change harmful traditional practices, there are steps that can be taken from within, internally driven approaches that actually help to change those harmful cultural practices from within. And Claire, I think climate change is like you, is probably the single biggest challenge that faces Homo sapiens at this particular juncture. And it encompasses structural violence, but it is maybe more urgent than all the other forms of structural violence, because it's going to become a driver of all the other kinds. And of course, it can lead to profound suffering and misery on a scale that's barely imaginable. And here again, I think what in the field of child protection we've done, and I'm applying this to me, this is not about other people, we've been perhaps a bit too focused on the urgent problems that are right in front of us. And I think we can never forget those, because they are horrendous violations of children's rights and well-being, and we have to be there. But we also have to strengthen prevention. And to do that, we really have to work on structural violence. So I think that over the next 10 years, much more attention to structural violence and to its drivers with regard to the structural problems like climate change ought to be uppermost in our minds. And it's not like we throw all the other good work that we're doing on child protection out the window, but we have to find a way to bring in this systemic attention to things like climate change if we're going to be accountable to children now and for the next hundreds of years. Thank you.
Thank you very much. And we do see a couple more questions that we will bring to the open discussion at the end that are very important and framing questions. But the next 15 minutes of the webinar will be 3 short responses to this new framework and article that I think is resonating with a lot of people. I'm going to do these in alphabetical order by last name, but there are 3 very exciting respondents. The first Next is Stella Ayo Odongo, who is the coordinator of the African Partnership to End Violence Against Children. I will put Stella's full biography in the chat box, but for 5 minutes, we will hear how Stella thinks that this framework is useful or not in responding to violence against children. Over to you, Stella.
Thank you very much. I hope I'm clear enough, or do I need to wear my headsets?
You sound great. Thank you.
So I'll keep them down. Thank you very much, Mark, and thank you, Mike, for those very illuminating article. It is actually an article that I would call long overdue. And without stating how long we've been working on this issue, I think a couple of years ago, when we're just having the conversation around child protection and the need to put children at the center of policy, at the center of politics, the question then arose that we cannot put them at the center because the costs of addressing the root causes of vulnerability are too high. So rather than address the problem, then I think many of us at that time chose to avoid and go for the soft targets. So I'll say this, that at the center of addressing child protection, for example, and violence against children, at the root cause of violence against children is the issue of poverty. But to be able to address poverty is to also address the root cause of vulnerability, which in many cases makes it very, very, very challenging. And many stakeholders, many governments shy away from this responsibility. So I'm glad that this paper is now addressing the issue of investing in structural violence, looking at the link between the structural and episodic violence that would then probably give us better results and maybe long-lasting results. A lot of the things that we see happening or recurring could also be perpetuated by the structures and systemic layers that actually perpetuate violence against children. So I think the paper actually touches on it very, very well. The second point that I want to raise, which is also highlighted in the paper, is the issue of investment. Again, it ties into the point that I mentioned earlier, that the child protection sector or violence against children is the children's sector in general has been the most least financed. When you look across the continent where I am in Africa, all the 53 countries, you will not find any country that has a budget beyond 0.2% of the national budget. That goes to the ministry that takes care of children. And usually that ministry is lumped up with many other ministries. I'll give an example of Uganda. Uganda has the Ministry of Gender, that underneath it has 5 other groups that are taken care of under that ministry. So we have women, we have children, we have youth, we have the elderly, and we have the disability. Now, by the time, when you get to the discussion table, by the time the priorities are divided up, the children's sector gets the list. So in terms of investment, this has been a sector that has actually suffered a lot in terms of prioritization and investment. But then we give thanks again, the paper does quite mention that the Sustainable Development Goals, for the first time, drew the attention of the world to the need to invest, to the need to address violence against children by explicitly stating in Target 16.2 the need to end all forms of violence against children. Again, to be able to buttress that, we need then the evidence, which is this conversation that we are having. We need the evidence to draw the attention of the politicians, to draw the attention of those that made or signed up to that declaration, that once we have signed up to these commitments, then we need to follow it up by action. The mechanism of the Global Partnership to End Violence Against Children, which the paper also addresses, is excellent. It actually needs to be promoted, especially the Pathfinder initiative, because therein lies the magic. Having worked on mobilizing governments to join the Pathfinding initiative, I realized that over the past 7 to 8 years that we've been working on this, that increasingly you see governments beginning to take leadership and fear the public leadership or fear shame by taking the role of becoming a pathfinder, and in that way placing children or ending violence against children at the center. Once we have that, then it is my considered opinion that it will inadvertently result into resources being allocated. I'll give an example. In Tanzania, for example, when Tanzania was announced amongst the first 5 pathfinding countries in the world, the government of Tanzania had multiple strategies on addressing different issues of children. These strategies were harmonized into one, and for the first time, there was an investment of $119 million by the government into the implementation of the plan. So, driving political will, using the mechanism, using the structural mechanism that have been established by the UN, and then using that to then draw investment into the sector is very, very important. My last point I would like to talk about is the issue of raising the visibility of the issue. There's a lot that has been said about violence against children. So much studies have been carried out, but we now need to bring the voices. And for me, it's building the agency of children to be able to change the structures, to be able to tilt the balance. And again, use the example of what worked in Uganda, that in 2016, before Uganda joined the Pathfinding Initiative, we had been making efforts to reach out to the politicians and say, look, the issue of violence against children for many years is an issue. So we need to be taking action. We have a study that is coming up, but nobody was listening until we convened an interactive sessions between policymakers, members of parliament, and survivors of violence. And these survivors were children that were either who were taken into early marriage because they lived in communities that encouraged early marriage, or children who found themselves in systems that were abusing them, those who were trafficked, and the children came and shared their experience. And for the first time, this is the change that happened. We saw the Parliament of Uganda dedicate a whole afternoon to debate on the issue of violence against children. And not only debate, but pass key resolutions, which now are informing the allocation of resources. So building the agency of children in the effort to bring to light structural violence is very, very critical. I'll stop there. I hope I've not gone beyond my 5 minutes. Thank you, Mark. Over to you.
Thank you for those excellent and very grounded points that you made, Stella. I'm sure we will return to them in the full discussion at the end. Coming up next is Andy Dawes, Associate Professor Emeritus in the Department of Psychology at the University of Cape Town, and I will put a fuller biography for Andy here. You also will have seen Andy's response to the article in the handouts. For those of you who let us know that my response was not working, I've uploaded a different version. Do let me know if that one is working for you to download. Thank you, and over to you, Andy.
Thank you very much, Mark, and good afternoon, good morning, good evening to everybody on the call. I'm speaking to you from Cape Town, about 10 miles from Cape Point, more or less the bottom of Africa. Mike and Kathleen, I think, have done us an enormous service in putting together a paper that rolls through the complexities of the situation. I think it'll be a seminal piece that people will refer to for many years. What I did in my commentary was to address 4 issues that related to the paper. I'm just going to pick up on a couple of them now in the time available to me. One of the things that our colleagues have spoken about is the importance of joining up structural and direct violence, or episodic violence as it's sometimes called. I couldn't agree more. However, it's an extremely challenging business to begin to do that. I'm going to make the suggestion that one small way forward in the first instance is to incorporate indicators of the consequences of structural violence alongside reports of direct violence to children. In other words, to start making that data much more salient, much more evident in both research reports, policy initiatives, and so on. So key indicators of structural violence and their relationship to violence against children and violence within families at each of the levels that they've spoken about need to be brought together. Now, there are lots of resources like this out there. UNICEF data, for example, national country level data on child poverty, malnutrition, and the like. These things, we should start to think about how could these things be joined up and incorporated in our conversations around violence to children. That, I believe, will raise the awareness of the problem that is not normally on the horizon at all. The second point that I'd like to make, and it's been alluded to already, is that we need to be very careful not to lay the focus of the problem in the family and predominantly in the caregiver. That is the women who are responsible for children. I really think this is very important, that we need always to take an ecological position and to understand that the violence perpetrated in the context of the home, let alone elsewhere, is intimately related with the conditions of life that prevail for the people in those homes, in their communities. As I speak right now, our former president has been jailed for contempt of the Constitutional Court, and massive violence has broken out in several parts of the country, to the extent that this afternoon the army has been deployed. So there you have youth violence that's impacting on every single household in these areas, in 2 provinces, which is constraining children who are already affected by the lockdown that we have for coronavirus. So what happens in those households has to be understood in the context of the wider violence that's going on around them. And often in our efforts to address violence to children, we focus on the family, which is appropriate. We focus on parenting skills and the like, but I would hope that we also step back and look at the context within which parenting abilities are constrained by the circumstances in which people live. My next point of 2 more speaks to the research community. If you look at the INSPIRE document, which is an absolutely great evidence-based document, and Mike has mentioned evidence-based is important, that evidence-based is normally drawn from high-level, highly internally valid randomized trials, or at least quasi-experiments. One of the things I would like to see much more of is tests of the external validity of these interventions. As Chris Mixton has said in another context, and he was part of INSPIRE once upon a time, we need to get to a point where we take what the science tells us, the evidence-based tells us, and take that into government spaces to scale, to communities to scale, and we cannot do that successfully if we don't have external validity tests. So internal validity, RCTs, and these sort of things are essential, but we must go the next step. So that's an appeal to researchers. I was told once by a colleague, well, we don't do that kind of work because it's not so easy to publish. So my challenge to researchers was move in that direction, because you can design the most wonderful study on the planet, lots of internal validity, it works. As soon as you take it outside into a new context, it starts to unravel because you haven't tested what is needed to make it work in a much more complicated situation with low levels of internal control. So that's a message to the researchers. And finally, I think that people maybe need to take a leaf out of some work that was done and led by Chris Mixton some years ago, and that is readiness assessment. When we go into a community or into families and so on, with programs of child maltreatment prevention, for example, the WHO has a system for readiness assessment for the prevention of these kinds of problems. And that's available on the WHO violence prevention website. Firstly, what we need to do is to look at the attitudes toward prevention that prevail in the context within which we wish to prevent whatever it is. We need to know something about their knowledge of prevention. We need to look at their availability of local data. We need to look at the success or otherwise of local program implementation. What's going on? What's the legislation say? What's the will to address the problem? A critical issue. And then finally, what resources exist? These are material, they are human, and they are social resources, the connectivity within the community within which those projects should be implemented. So I think those are my key points here, and I do think readiness assessment can take us forward into a space where we have a much better idea of what's likely to work where and what needs to be done to make it work more effectively. Thank you.
Thank you, Andy. And we've already had some questions based on your intervention and Stella's as well that we will bring to the open discussion for the last 15 minutes or so. So with no further ado, I will introduce our last respondent, Dr. Amy Ritterbush, who is Assistant Professor in the Department of Social Welfare at the University of California in Los Angeles, but joining us today from Colombia. Over to you, Amy. Thank you.
Thank you so much, Mark. And thanks again for the invitation to sort of think with this conceptual piece and provocation from Dr. Wessels and Castelny. It's really helpful in thinking forward toward the ways that we engage and center children and adolescents' voices in the work that we do in the daily. And so I have two provocations based on sort of engaging with this with Wessels and Castelny's provocation on sort of shifting the focus or understanding the role of structural violence and cultural violence and using these as an analytical lens for our work. In terms of this piece, makes me think about the importance of paying attention to spaces and how conceptualizing how the spaces surrounding children are also engaged to justify violence against them, right? And so I think directly from some of the work that we have done in Colombia and Uganda, using a youth participatory action research frame, I think about the space of the streets, right? When thinking about structural violence and thinking about the forces that push children, adolescents, and young people to the streets. And so this piece is particularly useful in thinking about how to conceptualize the spaces surrounding children as we're doing this important research and practice to inform the ways to end violence against children and adolescents. And so one of the things in terms of this first comment, so thinking about how to, the importance of space, right? And so if we use the example of the space of the street in our work, and we pay attention not only to the violence enacted against children, adolescents, and young people in the streets, but also thinking about how to counter this violence. So looking at context. And I guess the provocation that I would present is how to fill these spaces. So in the context of the streets, how can we fill the survival space of the street with initiatives that propel children and adolescents that depend on these street spaces toward acts of justice seeking, right? And so if we look at sort of the work of Freire and other sort of critical scholars that think about justice and liberation, if we think about critical consciousness building. So I think about the work of youth-driven and child-driven participatory action research. How can, in our research practice, and also in our child protection practice, how can we ground acts of critical consciousness building about structural violence. So basically thinking of ways. So one concrete way, sorry for that noise. Kairing. So thinking about how to sorry, I completely lost my train of thought, but centering children and adolescents in spaces of critical consciousness building about structural violence. So children and adolescents as agents of change, we facilitate spaces where children actually begin to reflect about the forces of inequality, the forces of oppression in their daily lives that actually then that use to sort of mobilize acts of justice seeking, right? So how can we get angry collectively about injustice in our daily lives? And how can that sort of productive rage through critical consciousness as we understand it in the sense set forth by Freire. So the ways that we move toward liberation is by sort of engaging with the inequalities and with the injustices in our everyday context. So how do we apply that, do more of that in our everyday research and sort of practice to support children's lives, right, and well-being. The second point that I wanted to make that sort of draws from this important piece and responses is thinking about Northern bias and power relations. So Kathleen mentions in the presentation and also in the piece the centering power as an analytical lens, right? And so one of the ideas that I want to set forth here is how can we, so the problem of Northern bias and sort of the reproduction of colonial colonial practices in both the ways that we do research and the ways that we do child protection on the ground every day. How do we not only work to revert this north-south flow of domination in this work that we're doing, but also, so it's not just about sort of reversing the logic of knowledge exchange, right? So the provocation in this piece is that we need to pay attention not only to knowledge that's produced in the global north, but also knowledges and practices that are produced in the global south. And I would argue that it's not just about reverting the flow, but it's paying attention to hierarchies of knowledge production and power in the everyday, right? And so part of that is this north-south dilemma, right? So prioritizing knowledges in the global south in the global north in order to inform our practice in the global south, right? So we need to revert that logic. But another important hierarchy that we need to pay attention to is also child-adult hierarchies, right? And in the ways that we do research. So sort of paying attention to these hierarchies, north, south, child, adult, and the power relations implicit in those, in the ways that we reproduce those hierarchies. So I guess moving forward, the provocation is to pay attention, to really reflect on how each and every one of us reproduce these hierarchies in the work that we do, in the ways that we do research, in the ways that we center or perhaps not the voices of children in our research practices, in the ways that we design programs. And so it's about sort of daily reflection on the ways that we reproduce these hierarchies of knowledge production and practice, and as an invitation to sort of to center children's voices, praxis, and dreams in justice-seeking work. So that is in the way that we do research, the way that we design programs, and really building up sustainable structures of care, both in our research teams and also in these teams of supporting the livelihood of children on the ground in the everyday work of child protection. So again, thank you so much.
Thank you, Amy, and a lot to dig into there. If I could ask all of our presenters and respondents to turn on their cams, I'm going to try to pull together some reactions in the questions and then ask each of you to just speak to those that that you feel empowered to speak on or interested to speak on. You know, the first, I'm going to talk about 3 areas here that hopefully will weave together, although not perfectly, various reactions that we've had. There is a lot of discussion about the evidence needed. Stella gave an example of how having the evidence was very persuasive in helping to mobilize government resources. Andy spoke about how the evidence could be strengthened through development or use of indicators of structural violence, determining the external validity of interventions. Amy has just spoken very powerfully about undoing power dynamics in research and program development processes. But Mfo, and I apologize if I'm not pronouncing your name correctly, Mfo Platje has said, how do we support small NGOs who are doing the work in the best way they can, but are not necessarily conversant with the global evidence base? And I think it's a question that gets to all of this, all of these considerations. So thank you for that question. And I think how we promote the evidence base in a way that undoes structural violence is really the core question here. The second area I'm going to highlight is around children's agency. Again, we heard Stella talk about the importance of having children's voices for bringing visibility to this. Amy very rightly asked us to center children in discussions of structural violence and justice-seeking behaviors. Salimatu Traore from Mali has asked very pointedly, how do we involve children more in this work? And I would add, and in a way that undoes these power differentials that we've been hearing about. The third area, not discrete and separate from the first 2, but really is around accountability. And we have a lot of questions around accountability here. Again, apologies for mispronunciations of names. Viheta Laxmi has mentioned that child protection systems are often adopted, the models are adopted from other countries and implemented, and children are confiscated and separated from their parents. Is this really in children's best interests, or is this a form of structural violence? And then 2 questions around accountability in the same way. Conjit, again, has asked if lack of accountability among UN structures, large NGOs, governments, etc., is itself a form of structural violence, to which Claudia Seymour has asked how these large and powerful institutions hold themselves accountable. We're really at the 5-minute mark, but I would like to give all of the speakers a chance to respond to these questions. So if there are still 88 people with us, so a lot of people have gone past the hour to stay with us today, and we thank you for that. Maybe if we can go in the same order on these 3 topics of how do we ethically and meaningfully create the evidence, enhance children's agency, and address accountability in this very complex ecosystem or overlapping ecosystems. First from Mike and Kathleen, then Stella, then Andy, then Amy. That would be wonderful. Over to you, Mike and Kathleen.
Thank you, Mark, and thank you for these excellent questions. If we had the answers to them all, you'd probably be in line for a Nobel Prize, right? I wanted to say something about the way in which we work, which I think cuts across all of these. I do think that coloniality is very inherent in the power structure within the humanitarian and development space. Almost everything we do, the big decisions, are shaped from people in the global north. People in the global south are often reduced to or infantilized, to the status of beneficiaries or victims who couldn't possibly help themselves. And I think we do need to be much more attentive to the power dynamics and to recognize that local people worldwide, including in countries like the US, who are marginalized, have tremendous understandings of their context. They have resilience, they have creativity, even under very difficult circumstances. And I'm not claiming that they don't need support in various ways, they do. But in many ways, we have left it to Western and Northern experts to sort of guide all the key decisions about, priority issues, about money, about which programs are indicated. And in the process, we've marginalized the local groups that are doing tremendous work and who have an in-depth understanding of the context and are in a position to avoid some of those problems that Andy mentioned, because they really do understand the context. So what I would suggest is that we make the work much less about ourselves and about our own agencies, and reconstruct our roles as fundamentally co-learning and maybe facilitating of dialogue and co-learning, with much more privileging of local ideas and local understandings, indigenous epistemologies, and really put children at the center of this too. Engage children as agents, as human beings who have a lot of contextual understanding, and draw, for example, on teenagers, enormous insights and problem-solving abilities, and to stop focusing so much on ourselves as the researchers. Make the children the researchers, use their understanding of the situation and the context to identify the key questions, to help bring forward grounded experience, and to use methodologies that honor their agency and their learning. But what it means is that we basically need to create more space. We need to be more humble, to recognize the power asymmetry, and to share greater power at all of these levels. So thank you very much.
Thank you, Mike, and over to you, Stella.
Thank you very much. I just want to build on the two questions. One, from what Mike has talked about, the need for us to be humble. And I think to move away from the rigor and get down to a simplicity in a manner in which we can bridge the gap between the complex research processes and the down-to-earth situations of children, which makes them more comfortable in the space. So those spaces need to be mindful of the age of the child, need to be mindful of the context of the child, and need to be able to adapt even to the different situations, the different circumstances. Many a time, like I mentioned earlier, we go for the easy wins. We would not want to go to a situation to get to collect data, for example, from a child with disability, because we do not have the skill. But rather than avoid getting the data, I think it's important that we adapt and bring ourselves down to be able to collect as wide data as possible and include as many children. In that way, we'll then bring them to the fore and bring them to the center in terms of them being part of the research. Another point I want to address is the issue of accountability, and a good question is asked. Who watches, I want to put it this way, who watches the watchdog? I mean, the big guns know what to do. The big guns seem to be all over the place, but then who is holding them accountable? And I think then that takes us to the question of the partnerships, because within the partnerships, I think we are able to assess each other. We are able to call each other to order. When you work together, then you know that it's not a space that you occupy on your own. It's no longer about who occupies which space, but it's about how we can collaboratively work together. So in that way, then we can have an inbuilt accountability mechanism where the big agencies look up to the small agencies, look up to the AU, look up to the UN, and are able to communicate around that one agenda. And that is about identifying a shared vision a shared vision together and working around this partnership. And I think, again, the evidence of the global partnership and the Africa partnership gives it a good framework. My last one relates to the issue of small organizations that are doing good work and seemingly do not meet the rigor of research and therefore at times get lost. And not only get lost in research, I just want to add, because of not adapting to the rigor of the research, but at times they also get lost because we bog them down with systems, we bog them down with procedures. You find a nice organization that is doing good work, and then before we know it, because they're doing good work, the North, like Amy mentioned, the North then brings in their money and say, we have this funding for you to expand your work. And then this poor organization that started out of passion, out of will, then gets lost in systems, in procedures, audits, that then takes away the attention from what they should be doing to then focusing on systems. And in that way, then they lose the focus on the issue and they go into system. That then leads to more systemic, perpetuating the systemic violence. I think I'll stop there. Over.
Thank you, Stella, and over to you, Andy, to keep building on this.
Thank you very much. And just two things, really. I think the word humility has been mentioned twice. I think that is a value that we should all be working towards. I don't think there's enough of that around, certainly in the academic context. It's a word that's rarely used and a state of mind and being that's really respected. So hopefully we can build onto that in some way. But let me say the issue of small NGOs and support, I found it quite useful to encourage small NGOs within certain geographical spaces and certain cultural areas to come together in learning communities. So a role as the facilitator of that process, so that one can hear from the ground, from people addressing similar problems, but informed by local practice, what people do, what their local solutions are, and then stitching those together with what the so-called evidence base might suggest would be helpful. So I think it's opening a dialogue between local practice and northern practice, if you want, the evidence-based bit, because I think there's a problem if one goes all the way down the local route, because we can all learn from each other. And the same thing, the problem of going all the way down the so-called northern hegemonic route. I think it's about building a dialogue between those two things. I remember from years ago work in Mozambique during the Civil War, when one had indigenous healers working in a particular way, and people and us being there to talk with them about this and saying, that's brilliant, but maybe you could try a little bit of this. Maybe this could be helpful to you. Like basically offering a different approach that came from the north to complement what they were already doing, and to how them works over time with that dialogue. And then finally, the accountability issue, I think, is a critical one. And I think what I've learned from my own country is the power of one of those northern devices called the Constitution, and the rights of children within a constitution, and the power that that can have to hold the state accountable when they are failing to protect children. I think this is a really important route, and in my own experience, working alongside the court in order to provide evidence that the court can then use to make things stick at a government level has been very, very salutary in my experience. Thanks.
Thank you, Andy. And last but not least, over to you, Amy.
So just echoing the interventions throughout the panel, I think I would focus on the principle and practice of collective work when addressing accountability, when thinking about sort of the how do we begin centering voices in research practice and in programming. And so I guess one of the main challenges that I have encountered doing this work is that we never sort of, it's we need to think about what resources are needed to actually do the work. So time and resources for collective work. So if we're thinking about designing research where children are the researchers, right? We need to put that into our budgets, time to build trust, time to create and think about concepts together, time to build relationships for justice seeking, right? Ways to actually compensate children for their time, while also thinking about how this balances or sort of reconfigures their daily lives. And so thinking about our commitment as researchers, but also thinking about programming when we design activities that are meant to sort of empower children, right? Are we thinking about the afterlife after that activity, right? So investing in the afterlife of these activities that build agency and that build sort of critical consciousness. So I think that, you know, just in very grounded terms, we need to think in the short term about how to adapt our current, you know, the ways that our work are currently structured. How can we build in more time and allocate more resources to building these relationships for justice seeking with children, right? And I would say, I guess, just to close on accountability, I think it's really important just thinking about sort of the academic realm. How can we hold researchers and universities accountable, right, for not just sort of in the IRB or ethics-driven, sort of institutional ethics-driven sense, but how can children hold researchers accountable for contributing to the afterlife of their projects, right? How can children, so I think about many of the children that are involved in our initiatives, Dame segundo, Jazz. How can we open up spaces to listen to children about how we're doing as researchers and receive that feedback and understand sort of, I think it's the role of reflexivity of universities and how we are sort of supporting children and adolescents after our projects in the afterlife, right? So like the sustainability and really reflecting on that. So, and thanks again so much.
Thank you, Amy. Before we close out, we are 10 minutes over, but most of the attendees are still with us. Mike and Kathleen, any last thoughts to wrap us up here?
Thank you. I mean, I find this discussion really quite inspiring. And I mean, I think that it points towards a new set of processes and steps that, as you've eloquently said, need to be collaborative, that involve the co-learning between North and South, as Andy has mentioned, and that, you know, as Stella has been inviting us to think about, really involves much more centrality of focus on the lives of children, and as Amy has said, you know, brings in their agency and makes that center stage. And if we can do that and interweave this work on structural and direct violence, I think it will be a big step forward and will actually contribute to the well-being of children. So I look forward to ongoing dialogue and really thank everyone for their participation and more for their great questions. And I want to thank also all the commentators, simply brilliant. Thank you.
I totally agree, and we had great engagement today. And those of you who sent questions, they were very deep and thought-provoking. So we really appreciate that. We are sorry that we didn't get quite to all of them, especially some of the more nitty-gritty ones. But yes, indeed, we will continue this conversation. Many thanks to Mike and Kathleen for what is, as Andy said, a seminal paper. I am very confident that the field of child protection and violence against children will keep returning to these concepts of structural and cultural violence, and I'm very appreciative to you for bringing them into the conversation. And to Stella, Andy, and Amy, thank you for your really brilliant reflections as well. With many thanks to the attendees who spent this hour and a half with us, we will close out here and stay in touch in other ways. Thank you all.